Today is not only Back to School Day, but it is also World Suicide Prevention Day, and people need support more than ever, obviously, during the pandemic. Our next guest is Stacy Ashton. She's the Executive Director of the Crisis Centre of B.C. Stacy, good morning and welcome to BT.
Thank you. Glad to be here.
Why are feelings like loneliness and people that are having a tough time with their mental health right now so important and so much more heightened right now during the pandemic?
Well, the coronavirus, COVID-19, has really changed so much about our life. I mean, you're seeing it today as it's back to school day, how different that feels this year than many other years. And all that change and uncertainty, it's just really hard for us to deal with in the short term, but also in a longer term, especially when we're isolated and aren't able to connect with people as much as we're used to.
And talk to us about the challenges of being isolated and feeling lonely when we have advice saying, you know, stay in your bubble and avoid big groups and things like that, just adding to the challenges that people are going through right now.
Yeah, absolutely. I mean, we are all going through times that we haven't been through before in our lifetime, where we're asked to do things differently than we ever have before. You know, whether you have a small bubble of people you're close to or you don't have a lot of people that you're connected to in your bubble, not being able to go out and meet new people and get a break from the regular, it's hard. It's very difficult for people.
And give us a sense of some of these survey findings with respect to mental health pre-pandemic and right now.
Yeah, so I mean, we did a survey to see how people were doing, and what we found was that definitely since COVID started, people are reporting a lot more anxiety and stress and just struggling with their emotional state and their frustrations and all of those things that make up balanced mental health.
And we live in an era of texting, but why is it so important to pick up the good old-fashioned phone to help someone who's in distress?
Yeah, well, we did our survey to find out how people preferred to get crisis service, and we were surprised. We thought, well, you know, a lot of people will prefer texting. It's more anonymous, lots of reasons why that might be. But people actually were saying that being on the phone, actually, you know that you are talking to someone, you know that you have their full attention, and you can really talk through things a little more thoroughly than you can on text. So a good 65% of the province told us that they prefer talking on the phone if it's about a stressful topic. So we're really glad to be able to provide that for people.
And Stacy, just give us a sense, describe some of the work that is done at the Crisis Centre of B.C. to help people in need.
Yeah. So what happens when you call a crisis line is one of our trained crisis service responders, many of them are volunteers, many are staff, will answer your call, and they'll just really ask you how you're doing and let you talk about whatever intense feelings you're having. You can think you're angry or upset over something silly, or it can be something very profound and difficult that you're facing. It doesn't matter. We will treat any crisis, we just treat as you are having emotions that are overwhelming you, and we're going to help you sort them through and get you to a place where you're calmer. And honestly, this process only takes about 12 minutes, so it's a very effective use of your time.
And as we close it out, the work that you do at the Crisis Centre and all the different resources available to people, do you think sometimes it's harder to admit you need help than actually get the help that's available?
Definitely. And we find that especially around suicidal thinking. So people who are, when you have a suicidal thought, it means that the coping skills you have available to you just aren't enough for the experience you're having right now. And it's saying, you know, go outside yourself and find additional help. And that's really what is going on. So a lot of people are really terrified that they have these thoughts. They feel like they can't share them with anything. But as soon as you share them, you can start to process them and put them in perspective and then actually decide what you want to do.
All right, crisiscentre.bc.ca for more. Stacy, thanks so much for the advice. We'll put it online for all of our viewers.
Thank you.
All right, you have a great day. That's Stacy Ashton, Executive Director of the Crisis Centre of BC, and we'll have